Hello, everyone. Thank you so much for participating in this international meeting. Thank you so much for taking your time to watch my presentation. Before I start, I would like to thank you all the organizers for this amazing meeting that we are having. And thank you for inviting me to share a little bit of my experience in pediatric exercise science field with you all. So I am Professor Wagner Prado. I'm from Brazil, and I am an assistant professor at the Department of Kinesiology at California State University, San Bernardino. And I am also proud to be a member of the International Organization Health, Sports, and Kinesiology. So let's go. So what I would like to share with you all today is how my experience in this field has changed the way I think and I understand the pediatric exercise field and what I have done in the last 15 years, how we can apply this knowledge, what we know now in order to increase physical activity levels in children and adolescents. And my main focus is in adolescents with obesity. So I have a few years of experience in this field. I have published my first paper in 2007, and my last one with obesity was in 2021. So I have doing a couple of things in between these years, and let me share with you all a little bit of what I have learned or what I don't know about this topic. So I believe that you all know, or at least have an idea, that childhood obesity is one important health issue all around the world. And what we can see here is that the problem by itself is huge, and it's getting worse year after year. So what we learn from this type of data is that even that we are learning more about obesity, if we are learning more about the benefits of being physical active or to have a, call it health diet or a health lifestyle, we are not being able to tackle obesity or to reduce the obesity prevalence all around the world. So here in the States, we have almost 40% of our children and adolescents with overweight or obesity. And even in countries that the prevalence is way lower, it's also high, okay? It's not acceptable to have more than 10% of our children and adolescents with overweight or obesity. So I would like to invite you all to navigate through this amazing publication from the World Obesity. It's the Atlas of Childhood Obesity. It was released in 2019, so the data is pretty new. And I just would like to highlight to you all data from Brazil that almost 200 countries nowadays have their physical activity card. Yes, so in these cards that are presented in the Atlas of Childhood Obesity, we can find some really interesting and important and alarming information about the physical activity levels in children and adolescents. As we can see here, unfortunately, in Brazil, our kids are not meeting the requirements for physical activity daily. And as we know, if this is directly related to the obesity problem. So I would invite you all to go to the wordobesity.org and download the atlas, and then you can search for your country, you can search for any data you want to take a look at. So here what we can see is that even that in Brazil, we have specific policies aiming to increase physical activity, aiming to increase health eating behaviors. Those policies seem to not be working, at least the way we expected. So why is so important for us to understand and try to reduce the obesity problem around the world, mainly in children and adolescents? Because if in the past, obesity was considered just a problem of excessive fatness, nowadays we know and it's clear that obesity is related with other several diseases, from several types of cancers or liver problems or diabetes, hypertension, so metabolic syndrome, that by the end of the day, we will reduce the patient quality of life and life expectancy. So they will die young, they will live less, and they will live with less quality. What is also will improve health costs, will increase a lot of problems associated with these problems associated with obesity. So it is even worse, or it is even more interesting to look at when we are talking about obesity in adolescents, because I used to say that no one cares about adolescents. Okay, so now I would challenge you to think in one health policy that you know in your country that the main focus is adolescents. We don't have. Maybe in some countries, pregnancy during adolescence is a big issue, alcohol problems or drug addictions. But when we are talking about health behaviors, usually the policies and all the organizations in general are more focused on children and then elderly people. But no one cared about adolescents. And my experience in the last 15 years allow me to say with confidence that not even the adolescents care about themselves. They also don't care about their health, about their feelings or other things that we are aiming to improve. So if we look in here, this data show us that less than 1% of all scientific publications in the health field, I'm not talking about obesity, but in the all health science field, less than 1% has focused in adolescents. And most part of this is related to pregnancy, alcohol addictions, drug addictions, or suicide, or premature death. So no one is really working with health behavior in adolescents. So we have minimal information in this topic. So what we are doing, what we are pretty much doing in the last 30, 50 years is try to use the same knowledge that we have from adults children or elderly people, and we are trying to use this knowledge to treat any sort of health problems during adolescence, but it's clearly not working. Okay, and why it's not working? For several reasons, but from a biological perspective or from a more medical perspective, obesity is treated as an energy balance problem. The message that is spread all around the world is you need to increase your physical activity levels, you need to reduce your energy intake, and you will solve the problem. Unfortunately, we all know that this is not true. It's not even close to be true. Obesity is not reduced to energy intake and energy expenditure. And also in several different contexts, it's not one individual choice to increase physical activity levels or to reduce energy intake. As we can see here in what is called the obesity map, we can see that several other aspects are modulating our patient or the individual body weight. So we have social determinants, psychological determinants, environmental aspects that are completely out of the individual's control. So this complex map is even more complex during adolescence for obvious reasons. They are changing their body, they are changing their understanding of life, their understanding of the world. They have several problems that are related to their age, to their maturational stage. But then we are inserting an extra component here, that is the obesity by itself. So we need to understand what is going on with these teenagers. What are their perceptions? Why they are not active? Why they have this eating behavior instead of more healthy eating behaviors? So what we need to do, it is like to solve a puzzle. The problem is that we believe that we have all the pieces, and we can, if we find a way to put all these pieces together, we will solve the puzzle. The problem here is that we don't have the pieces. The person with obesity, the adolescent with obesity, he has all the pieces in his mind, in his head. So what we need to do is to ask for help to have all the pieces and then help our clients to put all these pieces together, and he will solve the puzzle. I believe that here we need a mindset changing. As health professionals, we want to solve the puzzle. We want to find the pieces and solve the puzzle. But I am pretty confident that with adolescents, this approach will not work. We need to change our perspective. They want to do this by themselves. So we need to help them to find the pieces. We need to help them to put the pieces together. Then they will solve the problem. We are just modulating, we are just helping, we are just support in this process. A couple of years ago, in the middle of the pandemic, Dr. Cardell with other co-workers, they published this amazing paper, and they recommended that adolescents with obesity should exercise or be engaged in physical activity for at least 60 minutes per day, and also increase eating behavior and change other things. And it's amazing. We all agree with that, and they did a great work to putting all this information together. But the main problem is how to make these kids engage in physical activity, how to make these kids engage in a health diet. So this is what I'm doing in the last years with my co-workers. We are looking for several strategies to increase, to help these adolescents to treat obesity. We have worked with high intensity training. We have worked with low intensity training. We have worked with nutritional counseling, psychological counseling. And what our results showed us is that by the end of the day, doesn't matter what type of exercise they are doing. Doesn't matter what type, what exercise intensity they are exercising. The most important is they need to do something. Pretty much all health-related outcomes associated with obesity, from quality of life to hormones controlling eating behavior, will be improved by physical activity. Doesn't matter the type, intensity, mode, or nothing. So recently, in the last years, the high intensity interval training has gained attention for the society as a medical field to treat several problems, but also for obesity. And what we know from the scientific evidences is that high intensity interval training may be a really good strategy for improve cardiovascular risks, but it's not much better than continuous low intensity exercise to reduce body fat. For example, here we have another systematic review comparing the effects of interval training versus moderate exercise, showing that high intensity interval training is not better than continuous exercise to reduce fat. I am a fan of high intensity interval training as well. I am a fan of continuous low intensity exercise. It's another option that we have, but we don't need to put all our cards in high intensity interval training or low intensity training or continuous long run training. So what I'm trying to tell you is that everything works. Everything works. Obviously, high intensity training will lead to better body pressure control, will increase your way better cardiorespiratory fitness, but by itself will not change our obesity-related outcomes. It's as effective as any other intervention. Also, in the recent years, some studies are suggesting that even self-selected exercise intensity, what it means that if you just tell to your children, go there and do whatever you want, is equally effective to treat obesity-related health outcomes. Again, we need to do anything. Doesn't matter what we are prescribing. Here we can see in this systematic review that high prescribed and controlled exercise is not better than self-selected exercise intensity. What I'm trying to tell you again is you have a lot of options to offer to your clients. You don't need to be so strict and say, oh, this exercise is better, or this type, or this intensity. In this paper that we have published in 2020, we saw the same thing, that self-selected exercise intensity is equally effective to control cardiovascular risks in adolescents with obesity. So again, we know the benefits of being active. We know that our children and adolescents can exercise any way they want, but the fact is that they don't do. So the most problem nowadays is that we have no idea how to increase adolescent health behavior or adolescent physical activity levels. That we have some information showing what they don't want or what they see as a problem. So, is the lack of time, transportation, they need support from their family and their friends, they need money to exercise. Most of them simply don't like it, doing exercise. So we have some good information about what they don't want, but we have no idea what they want. So I believe that the future of our area, and for what my research group is moving forward, is we need to give voice to these adolescents. We need to talk with them and see what they want. Okay? So if you are as older as I am, you will remember that book, What Women Want. And that's the question I'm doing every single day. What adolescents with obesity want? What they have in their mind, what they are discussing, what motivated them, what is their goal at the end of the rainbow. Because we also always talk about health, physical activity and health. And let me tell you something. Adolescents don't care about health. We have some strong scientific support to say that health is not a motivating factor for adolescents to engage in any kind of intervention. We need to stop to talk about health with adolescents. I can guarantee you in the last 15 years, I'm talking with these kids and saying, hey, if you don't lose weight, if you don't control your obesity, you will die young. You will die at age 30. And they look at me and say, 30? Okay, I will take that. They don't care because they are not feeling, it's not real for them. It's not something that they can see. They are not feeling the pain now. What they want. We need to give voice to these kids. We need to stop to think that we know everything, and we need to teach them what they need to do. We need to stop thinking that we need to teach them how to lose weight, how to control obesity, and we need to listen to them, what they want. I am afraid to say that, but I am a big fan of McDonald's TV commercials. And here, it's not a work, but I can share with you all later. All the Happy Meal TV commercials, it's all about happiness. What McDonald's is selling is happiness. That's why it's called a Happy Meal. They don't care, not even about the toy. They don't care about the sandwiches. They are selling happiness. What are we selling? What are we offering to this kid? Health? Come on, they don't care. We know that physical activity is good. We know that physical activity is important. We know that physical activity has a meaning. But what is the meaning, this meaning to these kids? Let's hear them. That's why with my research group at CSUSB. We have now an internal brain from the Center of Health Equity, and we are starting our new research where we want to give a voice to these kids. We want to hear from them what they want. And based on what they want, we will develop and offer an intervention that has a meaning to them, a meaning to their family, and hopefully a meaning to the physicians, to the medical doctor that ultimately will refer our intervention. So I am really excited that in 1 or 2 years, we can start to share with you all our results and our ideas. So you are more than welcome to join me and my research group in my next phase to build something based on adolescents with obesity perspective. We are forgetting about what we want, what we like, what is important for us, and we want to hear from them. Again, I would like to thank you all the organizers for this amazing meeting. And I hope you have enjoyed this talk, this video. Feel free to email me. You know how to reach me out. I am on Twitter. I will be more than happy to chat with you. And also, I am free for questions, comments, opinions, and we can chat during this meeting and also afterwards. Okay, it was a pleasure to spend this time with you all, and I hope to see you in person soon. Bye-bye.